Schizophrenia is a mental disorder that usually includes hallucinations, delusions, and disordered thinking. People with schizophrenia have a different perception of reality. There's a few symptoms of schizophrenia, but they can be narrowed down into three categories: positive, negative, and cognitive symptoms. Some of the positive symptoms include hallucinations. This is basically just perceiving something that contradicts reality. They're usually known as visual or auditory, but they can actually affect any of our senses. There's also delusions, which is belief that contradicts reality. Some examples would be thinking that you have a superpower, or that someone is going to hurt you, also known as paranoia, or that there's something or someone controlling you. Another symptom is disordered thinking. That is a difficulty in communicating in a conversation. They may jump from topic to topic, or they may use words that do not make sense in the sentence. Some of the negative symptoms are social withdrawal, which causes a person with schizophrenia to isolate themselves. This can affect their personal relationships. There's also lack of affect. This is also known as the flat affect. And when people are going through the flat affect, they may seem apathetic. They may not seem to have any emotional responses or emotional facial expressions. Another symptom is reduced motivation, and this is when a person with schizophrenia stops doing important needed tasks. This can affect their hygiene, which can be their personal hygiene or doing household chores, their health, and if they're in work or a student, it can affect their performance. Some of the cognitive symptoms include poor problem solving. This can cause them to have difficulty solving issues in their everyday life if a problem arises. Another symptom is attention deficit. This can cause a person with schizophrenia to have trouble with concentration or focusing. They can also be easily distracted, and their thinking may be inconsistent. Another symptom is low psychomotor speed. This can cause a person with schizophrenia to have slower reaction times, or they may alternate between numbers or letters in sequences or in sentences.
Now that we understand the symptoms of schizophrenia, what about the causes of it? The causes of schizophrenia are complex, and there are multiple key areas when it comes to research. The areas include two major focal points: genetic and environmental influence. What's most important to note as we delve into this topic is that research shows it usually tends to be a combination of what will be discussed that contributes to schizophrenia, not one ultimate decider. Even more, despite these factors, schizophrenia can still become present anyway, or be genetically present and never express itself at all. For now, we will focus on the primary genetic aspects. From what we know, schizophrenia is associated with hundreds of genetic variations. An example of this is seen in the instance of the D1SC1 gene, which is key in regulation of important functions like embryonic and adult neurogenesis. This specific gene is just an example of one of the many genetic mutations that exist and can increase the likelihood of schizophrenia. In addition, there is evidence showing that parental age can play a role in susceptibility. Fathers who carry a gene related to schizophrenia expression will have that gene multiply in their spermatocytes over the course of their life, meaning offspring of older fathers with more duplication of these genes are at higher risk. Now, while pinpointing the genotypes for schizophrenia is important, the addition of epigenetic research shows how environmental impact plays an even more significant role. We see factors come into the picture, like prenatal interference. An example would be a malnourished mother who can't supply enough nutrients to the placenta. But even exposure to outside emotional stress and trauma on the mother's body increases development of schizophrenia in the genes of the fetus. Some other causes include maternal viral infection, like the flu virus, because of the way the mother's antibodies attack fetal cells. And the most obvious being tobacco use, as well as alcohol use that exceeds more than 210 milliliters of pure alcohol per week. This is based on the DNA formation of the offspring and how its genes build around stress hormones and other toxic elements that may come in contact with the fetus. Further, we see that complications at the time of birth can also cause frequency of schizophrenia. Emergency C-section, uterine infection, and any general oxygen deprivation can all negatively affect brain growth and later lead to diagnosis. Another amongst the environmental risks for schizophrenia is a vitamin D deficiency. Studies show us that individuals with deficiencies in this area are more likely to be diagnosed later in life. This is due to the fact that the vitamin plays an essential role in brain development, so lack of it will interfere. The last risk factor, and possibly the most interesting, is the seasonal risk associated with schizophrenia. A study with 13,000 schizophrenic patients who live in the Northern Hemisphere showed a correlation between the diagnosis and being born between the months of February through May. Studies from the Southern Hemisphere showed the same correlation according to their seasonal changes as well. Though the information may seem bizarre, this does tend to match up with previous mentioned factors like vitamin D deficiency because of the cold, sunless climate that accompanies these months. With all these genetic and environmental factors involved, what research tends to emphasize the most about the causes of schizophrenia is that there isn't one sole genetic factor or certain affliction associated with the actual cause. Instead, it can be seen as an interactive factor, with many gene-related causes. These schizophrenic genes are varied and perhaps even more common than we realize, ultimately expressing themselves in reaction to the environment around them.
Behavioral and physical side of schizophrenia. Behavioral anomalies is someone with less sociable, some deficiency of psychomotor functioning. Some other behavioral anomalies can be abnormal movements or some negative effects of facial expression. Physical anomalies, some examples can be the hands, the eyes, the head, the ear, the feet, and the mouth. Hands can be curved in the fifth finger. The eyes, the skin fold at the inner of their eye. The head, two or more hair whorls. The ears, low seated ears or asymmetrical ears. The feet, the third toe is longer than the second toe. And the mouth, high steeped palate. The brain anomalies of schizophrenia. To find brain anomalies in the people who get diagnosed with schizophrenia, CT and MRI scans need to be done to diagnose the person. The brain anomalies might be developed during childhood. Some as early as 13 years of age can be onset of schizophrenia, brain anomalies, and not even know it. So I put a picture here of the affected and the unaffected. The gray area that's enlarged, it's the affected, and the grayer area that's not enlarged is the unaffected. According to chapter 17, enlarged ventricles is the loss of brain tissue, loss in frontal and temporal cortex, which it suggests that genetic factors affected cortical development and increased susceptibility to factors that cause schizophrenia.
Alright, so I'm going to be going over the different kinds of treatments used for someone diagnosed with schizophrenia. The first thing I'm going to talk about is antipsychotic drugs. They've been shown to be the most effective medical intervention. I'm going to go over 3 different kinds of drugs. Antipsychotic drugs are used to eliminate symptoms such as hallucinations and delusions. So the first one, the first atypical antipsychotic medication reduces positive, negative, and cognitive symptoms. The second one treats schizophrenia and anxiety. And the third one treats mental disorders such as schizophrenia and bipolar disorders. Antipsychotic drugs have helped people with schizophrenia in many ways, but that does not mean that it fully cures the disorder. The treatment is best paired with a form of therapy, which I will be discussing next. So the second form of treatment would be therapy and support groups. Therapy and support groups try to eliminate symptoms as well. Some include cognitive behavioral therapy, which is a form of therapy that focuses on symptoms that do not go away with treatment. This is a way for patients to test the reality of their thoughts, how to manage symptoms, and how to replace disordered thoughts with accurate ones. The second one is rehabilitation programs. These are programs that help retrain the brains to improve mental and physical functioning. This is like improving behaviors, they do skills and focus on mental health. The third one is support groups. It's a form of counseling where people share experiences with other people who are going through this similar situation. With all of this in mind, there is no best treatment for someone who's suffering with schizophrenia. The most effective treatment is a combination of a medication and a form of therapy, which I listed right here.
Hello everyone, my name is Jose Hernandez, and today I'm going to be talking to you about celebrities who have schizophrenia. Unfortunately, my camera is not working at the time, so I will be screen recording this with my voice. John Forbes Nash Jr. is the first person on our list, and he was actually also one of the very few people to be diagnosed with schizophrenia when it was first coming around. Up next, we have Lionel Aldridge, Zelda Fitzgerald, Peter Allen Greenbaum, Alexander Lee Skip Spence. All of them had schizophrenia, but unfortunately, none of them are with us to this day. The only one still alive is Daryl Clayton Hammond. Moving on to how schizophrenia affected their lives, John Nash was living horribly with his condition. With taking the medication for schizophrenia, he couldn't really function properly, and he was seeing how this condition was affecting his family, and it was just making it worse with the medication he was taking. So, all in all, he stopped taking the medication and began to live with his condition, ignoring all hallucinations he saw until the day of his death. Lionel Aldridge had retired from football after 10 years of playing, but shortly after he had manifested paranoid schizophrenia, and eventually became homeless due to it and lost everyone he knew. But after a while finding himself, he then got back on his feet and began helping the homeless before his death. Dale Hammond had a horrible childhood and adult life due to the abuse he had received as a kid, and when all of that trauma started creeping back to him during his adult years, he was actually misdiagnosed of schizophrenia during his relapse of trauma. He's also not the only one to be misdiagnosed, and he probably won't be the last. But even still, it is worth it to share his experience of trauma and how he's doing. Anyways, that is it for my slides. I hope you all enjoyed, and have a great day.